Well, we're excited to be here. I'm actually here with Dr. Karen Baya, and she's one of our cardiologists. How long have you been at Shannon?
About a year and a half now. So we moved in August of 2018 or 2017, so that's a year and a half.
One of the big reasons why we're here today is because Shannon actually received an award being named the top 50 cardiovascular hospital in the country, not just in the state of Texas, but in the country. And we're actually only one of 3 that have been named in the state of Texas, which I think is pretty amazing. I'm not surprised given the caliber of our doctors and staff, but I think is amazing, and it's a very elite award.
A lot of the credit for the award goes to the entire team because, of course, it's not just the doctors, it's not just the nurses. I think it's the entire team, the Cath lab team, the interventional, the non-interventional physicians, the clinic staff, nurses. So I think we work really well as a team. I think that speaks highly of our teamwork and of the team effort.
We're real excited to be here in our hybrid room, and I'm here with Dr. Hume and I'm here with Dr. Felger, and there are heart surgeons here at Shannon. And tell me a little bit about the heart program here at Shannon, Dr. Hume.
Our goal for this area has always been to provide care for patients that live in San Angelo and the surrounding areas so they don't have to travel to the bigger cities. We want to offer the state-of-the-art care for them. We want to offer the same things they could get in the bigger cities, and we've been doing that with about 150 to 200 procedures a year. We match our results with not only Austin, but Dallas, Boston, Cleveland. We hold ourselves to the same standards that patients can go elsewhere and get.
This room is really amazing. I'm just amazed with the technology that we're seeing in this room and the size of this room.
About 2012, Mr. Horner and I kind of started talking about building a room like this because we knew that this was kind of the future of medicine, to try to apply a little bit more minimally invasive techniques.
I was really impressed not only with you guys, but also with the OR team that were with you, as well as anesthesia. Can you talk about, because a lot of it, they're specifically trained to be in the room with you guys.
The same 4 cardiovascular anesthesiologists do all the cardiovascular cases. And then our surgical team is a very tight-knit, well-trained team.
We just recently were named top 50 cardiovascular hospital in the nation. You guys are a big part of that. Tell us what that means to you guys.
It requires so many people involved for us to get an achievement of that magnitude. We're all real proud of it. It still means we still go back and do the same things for everybody every day, but that benchmarks delivering a top quality product for as cost efficient as we can be, and have to be patient-centered, where the patient's first, their outcomes are most important.
Well, I'm real excited about being here in the new Cath lab, and I'm actually here with Dr. Rudy Haddad and as well as Dr. Chris Haddad. You're not seeing double vision. They're actually twin brothers, and we're really lucky to have them here at Shannon. This is an amazing facility, and I know we just opened it up. How long has it been open?
A little over a month, about 6 weeks. Mid-December we did our first case. We have 3 rooms that look a lot like this one. As you can see, we have these giant monitors that are in each of the 3 Cath labs, which have made the imaging capabilities really unprecedented.
We have these facilities that are really second to none. But we have a team that I tell you is second to none, and so we are able to do everything to help take care of these patients here, and we have fantastic outcomes, and we're all proud of that.
I'm real excited about just recently we were named top 50 cardiology hospital in not just in the state but in the country.
This is really truly an honor that as you know, Shane, you can't apply for. It's not something we knew was coming. It truly is a metric of what our outcomes have been in terms of our care for patients with heart attack and patients with heart failure.
It's our desire, I mean mine and Rudy's, and I think our whole department, that anyone in this area in West Texas, that when they think of where they want their heart care, they say it's Shannon, they say it's San Angelo. We have a clinic that we go to in Big Spring. We have outreach with our department to the south in Brady. So, our goal is to make every patient say this is where they want to get their care, and the way we do that is by the way we treat the patients and then our outcomes.
I'm actually here with Pam Bradshaw. She's our Chief Operating Officer. Now we're in what we call our 5th and 6th floor, and during this tower expansion, we've added additional beds. And Pam, can you kind of tell me a little bit about how many additional beds we did add?
Absolutely. We were able to add 15 on both the 5th and 6th floor, so a total of 30 additional beds.
So what is that going to allow us to be able to do?
I think the greatest thing that it allows us is some flexibility. In the past, a lot of times we end up holding patients in the emergency department because we don't have beds. And the great news is, since we've opened these beds, we've been able to fill them, which is great for us, and our patients don't have to wait in the emergency department. And it makes it a lot easier on our staff that are trying to get those patients in the beds, because there's actually a bed we can use instead of having to just wait.
You know what I love about these rooms is one is the big windows, and of course it's all of these rooms are brand new. What do you love about these rooms?
I love it because the way that it's laid out is very friendly for the staff. It's easy to come in, you've got a lot of space to be able to move around and take care of the patients. There's plenty of room for the families as well. But I think the best thing is that our patients love these rooms. We've actually received a lot of positive comments about them.
Pam, thank you so much for your time today and kind of going over the new space that we just moved in, and really appreciate all you do.